right, how's everyone doing? Again, my name is Dr. Mary Goforth. I am one of the pelvic specialists at one of our offices in Woodfin. And yes, I'm a pelvic specialist PT, one of the PTs, specialized in treating different pelvic floor dysfunction. So I like what one of my coworkers said today. I'm going to use her phrase. We're going to debunk a myth, and that is that Kegels, or Kegels, however you want to say them, are just for women. Not true. So to let that make a little more sense, we're going to look at the pelvic floor real quick. Here's the pelvis, the front of the pubic bone in your lower abdomen, the last lumbar vertebra in your back, and then the tops of the pelvis you find when you put your hand on your waist, that shelf you fall onto. So inside, anything red you see is a muscle. So the ones that make up like a circle at the bottom, and you probably saw me point to this on another video, those are the main ones that make up the pelvic floor. So men and women have them. Yes, guys, you do have them as well. So why do we need to know how to do a Kegel or Kegel, which is just contracting those muscles? And that is if you're having a problem. I mean, in general, you do want to practice for strength, but especially if you're noticing that you're having some urinary incontinence or peeing on yourself when it's not time to go to the bathroom is not desirable. Whether you're coughing, sneezing, you're leaking when you get the urge and trying to get to the bathroom, you're weightlifting heavy and you leak, that's actually not normal, guys, by the way. So a lot of my male patients that I see for urinary leakage, it's been right after they've had a prostate surgery, whether it was cancer or just enlarged and it was affecting their urination. They'll go in and take out part or all of the prostate to get rid of the cancer, or they'll take out pieces, usually if it's just an enlarged prostate, but it's interrupting their flow of urine. And sometimes after doing those procedures, they'll have urinary leakage when they didn't have any before. So that is one very specific, very common scenario that I see all the time in my male patients when they're having leakage, and they can benefit from doing Kegels, which again is just contracting those muscles to make them even stronger, because especially, guys, if this is you and you've had what they call a radical prostatectomy, which basically just means they've taken out the whole prostate, including the part of the urethra that's encased within it, and within that, the internal urethral sphincter, which is not under voluntary control, it's just working on its own, unbeknownst to you, to not let you leak when it's not the appropriate time. When they do a radical prostatectomy, they have to take all of that out. So now you only have one line of defense as far as sphincters go, the external urethral sphincter, which is under voluntary control, meaning when you do a Kegel and you're squeezing and lifting those internal muscles, that can cut off the flow of urine when it's not the appropriate time. And on its own, those pelvic floor muscles are doing their thing and just kind of holding a certain level of contraction throughout the day, more so when you're doing more effortful activities, sneezing, coughing, lifting, walking, so that you don't leak on yourself. So again, guys, Kegels are for you too, whether it's you're trying to get rid of current urinary leakage, you're just trying to prevent it. Don't overdo it if you're not having a problem, meaning don't do 1,000 Kegels in a day and you have no leakage. That could contribute to having pelvic pain and dysfunction, constipation. But if you're having leakage, you should do them. And if you're not sure, go get checked out by a pelvic specialist like myself. I work at, again, the Woodfin location, and then we have some other amazing therapists at our Arden location as well. And in the future, we'll probably have some as well at our East Asheville location. So that is all for today, and I'll see you guys next time.